I'd like to call to order the Board of Commissioners Health and Human Service Committee meeting of Wednesday, October 11th, 2023. Can we please start with the Pledge of Allegiance?
You're like me, baby.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Motion to approve the agenda.
Motion by Romano, approve the agenda.
Support Zinner.
Please vote.
Motion passes 10-0.
Moving on to item 4, approval of the minutes dated September 14th, 2023. Motion to approve.
Motion to approve Van Sickle.
Support Romano.
Please vote.
Motion passes 10-0.
Thank you. Now we're going to move on to public participation. At this time, if anyone wishes to be heard, they'll be given 3 minutes to speak on any item which is on the agenda tonight. Hello.
Good afternoon. Thank you for this time. My name is Brian Hart. I am CEO of the Michigan Institute of Forensic Science and Medicine. We just wanted to arrive here at the meeting and meet everyone face to face and offer any services or collaboration with your medical examining process moving forward with Macomb County and Oakland County. Thank you very much. Chairman Brown was actually nice enough to grab some items from us that explain all of our services and what we have to offer, full comprehensive services. Thank you very much for your time. Have a great afternoon.
Thank you, and thank you for coming out today. Anyone else? Hello.
Hi everyone. Hi, my name is Lori Phillips. Today you are reviewing the budgets of Martha T. Berry and the Macomb County Community Mental Health. Both of these have played an important part in my life. Over a year ago, Martha T. Berry became home to my father. He passed away there on September 6th of this year. The care he received was wonderful. Our family was so grateful beyond words that the county had a place that Dad could go that was clean, respectful of him and our family. I wanted to say thank you to Martha T. Berry and the Board of Commissioners for the supporting of all that call Martha T. Berry home for their loved ones. Macomb County Community Mental Health has been a part of my life for over 30 years. I have a 37-year-old son with autism who has received services. Because of all these services, his life is better today, which means his dad's and my life have been less stressful at home. There have been many changes over the years, some good, some not so good. The not so good was prior to 2018 when services were cut for all people who use community mental health. Questions and complaints would be left unanswered. In 2018, because of the lack of transparency, I applied to be appointed to the Board of Community Mental Health and was appointed by you, the Board of Commissioners, to serve. I knew little about the Community Mental Health Board at that time, but as a parent whose son has received services, I did know what was working for those in my family and my family of friends with developmental disability children. Since Mr. Pankatai has taken on the role of CEO, his commitment and openness have been exemplary. He and his team of all CMH employees, those who CMH has contracted with to service the people of Macomb, has expanded. The many new joint ventures with agencies in Macomb have made us better. No, let me restate that. the best in the state. Thank you all serving on our Board of Commissioners to keep CMH moving forward for our county to serve all. Thank you.
Thank you. Anyone else wish to speak at this time? Seeing none, I will,
Chairwoman Placido, may I?
yes.
Want to offer a moment of silence for the terrorist attack on the state of Israel that cost many thousands, many people's lives. And so I want to just take a moment to apologize in remembrance to the people that lost their lives in the attack. Thank you, Madam Chairwoman.
Thank you, Commissioner Brown. With that, we'll move on to department recommendations. And we are going to start with item A, which is a contract variety food service. Food service contract for senior services food programs in the amount of $1,354,400. And we have Ms. Coate here. Hello, how are you?
Hello, good
Motion to
afternoon.
recommend to full
Oh,
board?
Thank you. Motion.
Sorry.
It's okay. So what you have before you is a contract with Variety Foods. They are one of our 3 production kitchens that we use for Meals on Wheels. It's a 2-year contract that provides approximately 225,000 meals over the next 2 years. The bid was closed on 8/24, August 24th, and there were some negotiations that took place. The competitor only bid on part of the route that would cause some logistical issues on our end. So we went with Variety. Variety vendor also offered a 2% discount for prompt payment. So they won the bid process and we're going with them. I'd be happy to answer any questions.
Thank you. Seeing no speakers, can we please vote? Easy.
All set?
Motion passes 10-0.
Thank you.
Thank you. All right, now we're going to move on to a full board approval request at committee to rescind the medical examiner appointment, Dr. Daniel Spitz. Oh, thank you. To move to full board. Hello, Mr. Hawk. How are you?
Good afternoon, Commissioners.
Oh.
Thank you, Chair.
Move to approve.
Do we need a motion?
Well, we have a motion. Can I get support?
Support.
Thank you. All right.
Set?
Yes.
Okay, thank you. Thank you, Chair. Hello, Commissioners. Today I am bringing forward 3 items on this request to you. The first is to rescind the appointment of our current medical examiner, Dr. Daniel Spitz. The other item is to approve interlocal agreement between Macomb County and Oakland County Medical Examiner's Office for their medical examiner services. And the third item is to appoint the medical examiner for Macomb County, Dr. Dragovic, who is the Oakland County Chief Medical Examiner in Oakland County. We were received in September. Spitz Pathology Group, SPG, gave us notice to terminate their contract. Within that contract language, there's a 90-day agreement that they have to provide us with. So that 90 days is effective until January 11th of 2024. In that process, though, it is necessary that we have transition. So with that notice from SPG, we immediately went into our planning to make sure that our continual services of this mandated service in the county continue. And that's the priority here, that we don't have interruption of services. And that's why I appreciate you voting today for full board, because that transition needs to occur with the notice, the additional notice that we got from SPG that they would like to stop autopsies effective today. So that transition needs to occur, that needs to be approved today to make sure that we have and continue to have our medical examiner services and we provide that service to our county. With this, if you approve these items effective tomorrow, Oakland County would now start to conduct the forensic examinations, or what we also call autopsies, in Oakland County. The bodies would be transported from site. So our office, and one of the things we want to make sure that is clear is that our office will continue to run and operate. So all of our staff, except for the forensic pathologists, are county employees, which I've highlighted in the past, but I just wanted to remind everyone that they are county employees. So they will continue to operate in the medical examiner's office and provide that service. So they will be going on site. They will also be maintaining operations at our morgue that we have in Macomb County. Those bodies will then be transported then to Oakland County where the autopsies will occur. We will arrange then for body transfer after that, whether it be with the funeral directors directly with Oakland County or back to our morgue if storage is needed longer term for this arrangement. I think this transition allows us, we've spent a lot of time considering moving these positions from contractual to county staff. And I think this will allow us very much to have better oversight over the operations of the medical examiner's office, something that is very appealing for us, and that we think this is the best route. We've looked at multiple different models throughout the state, and we've seen this model work be very successful. It is the model at Oakland County and others within the state. And there's a good relationship between both the clinical and administrative operations within that office, especially by having that close relationship. And I think that is only added with bringing these county positions into our county. We have worked very closely with our partners in HR to come up with a very strong marketing campaign to attract local talent, and then also looking internally within the health department, within our existing budgets, to unfortunately sacrifice some positions to make these county positions. But we just feel the need, it's a priority, and this is how we should get it done. So that is why you don't see any amendment requests or budget dollars at this time. We feel like we can make these positions county positions without that ask. So we're very excited about that opportunity. Those positions are going to be actually posted as soon as we can with the partnership with Human Resources. We just went through the transition of Workday, but luckily that pause is going to come just right time for us to post those this week. So those will be up. You'll see those positions. They might already be up as we speak, because we are committed that this agreement with Oakland County is only a temporary transition until we can get our own physicians and operate out of our existing building, which we have tied and put in significant resources. It's a great building. As you recall, we have a really great piece of equipment that we just recently updated, $500,000 X-ray piece of equipment, and several different expansion items with the morgue and the cooler, and then also technology and equipment that we've invested in. So we feel very strongly we have a great facility to attract great physicians nationwide. We looked at very much looking at comparisons with HR about different salaries and benefit packages. We feel like we had a very, very competitive offer to attract someone to Macomb County. We have a lot to offer for someone to make Macomb your home, we feel like. But we have posted those immediately. We are very excited to bring on and look at those physicians during this transition. I will say that Oakland County has been a tremendous partner throughout this. We have really gotten a closer relationship as a result of this planning that we've done. We've already started to work and present at different agencies across the county. We've had meetings with funeral directors. We've made contact with the lab services, transportation services that we utilized. We also have plans to work with our first responders. We've met with the fire chiefs. We have a meeting later this month with the police chiefs. We really want to be transparent with this transition. We know there could be some hiccups in the road. Nothing is perfect, but we've really tried our best to really make this a really smooth transition for everyone. And we're hoping that we can get these docs on board as quick as possible so that we can have this operation come back to Macomb County in our medical examiner's office. I'll be happy to answer questions that you might have.
So I do have one quick question for you. After the 90 days is up, which is January 11th, if there is testimony that is necessary for pending litigation cases, is there a contract in place with Mr. Spitz to be able to come back and do that testimony at that time if we need him?
That's a really good question, and one of the partners I forgot to mention is our prosecutor's office. We met with them recently about that very same topic. There's not a contract with Spitz. We feel that it's his obligation professionally to do that testimony, and we will work with the prosecutor's office to do that.
Commissioner Hawk.
Thank you, Chair. That was part of the question I was going to ask as well. Well, hi, Andrew. You just said that's part of his professional obligation and you would expect him to perform it. What if he chooses not to and the prosecutor's office needs testimony in a case? What happens then?
I think there's a legal way to obligate him to show through a subpoena.
Not talking about a lawsuit, are you?
I didn't say lawsuit. I think legally through a subpoena
I know
to
one usually
request
is
that testimony.
synonymous with the other. That's the problem I have with that word. So you're saying you're pretty confident that he's going to follow his professional obligation and show up and testify at the request of the prosecutor's office?
I can't speak to Dr. Spitz's obligations in terms of where he's at. I would hope that professionally he makes that right choice, and I think we have some tools to make that happen.
And you have talked to the prosecutor's office about options that are available for this particular situation?
We did have some initial conversations.
Okay, were they informed prior to, I support your initiative 100%. I should have qualified everything I'm saying with that. But was the prosecutor's office informed that this transition was going to take place prior to a decision being made? Because they're an integral part of the need here.
So are you asking before Spitz
Right.
Pathology Group gave us notice?
Right.
Did we meet with them? No, because he provided that notice. He terminated the contract.
Okay, I'm just gonna reiterate, I don't expect anybody coming back here saying we have to sue him to get him to perform his legal responsibilities as you just defined. Okay?
Okay.
Thank you. Thank you, Chair.
Thank you. Commissioner Nard.
Hi, Andrew. Commissioner Lucido and Commissioner Hogg touched on the first thing I was going to ask about, so that's done. And then I just wanted to know, I didn't hear you say anything about body removal. Was his office part of that, or is that a separate entity, and what are we going to do with that going forward?
Yeah, that's a separate contract that we contract out with body removal services, so that's totally separate from the SPG contract. That will remain in place. So we still have the body transportation.
Okay. Thank you.
Chair Romano.
Thank you, Chair. Good afternoon.
Good afternoon.
Wouldn't it be more cost-effective instead of having them take the bodies to Macomb County, have them taken directly to Oakland County? Now we eliminate transport from Macomb County to Oakland County, back from Oakland County to Macomb County, and now we're using up people, and there's a lot of cost involved with that. The second question would be, why not have the medical examiner, since we're going to have it prepped here, have him come directly to us?
In terms of the bodies, or you're talking about the physicians themselves?
I'm sorry?
Are you asking about the physicians from Oakland County coming and operating out of our morgue?
Yes, but we're going to have the body here, we're going to have it prepped here, and then we're going to ship it to Oakland County. Why not just have Oakland County come to us and it's prepared and ready to go? Because
of the coverage issues with they still obviously are servicing their county as well. They need to remain in Oakland County. We asked about that. We had, obviously we'd prefer them coming out to Macomb County to do these autopsies, but they have all their tools, the resources, all the cases that they have to do with Oakland County at their offices. So that just wasn't feasible for them to come out to our office.
Okay, when we solicit for medical examiners, do we solicit other municipalities, or are you just gonna put out a general, I mean, we get notices here at the board for positions being available. Doesn't do any good to post it on our board, but I'm saying, how do you solicit other medical examiners? Do you go directly to them, or just a general newspaper ad? How do you obtain medical
We have
examiners?
quite a robust, I think, strategy in terms of marketing these positions. There is a accreditation board called NAME
Okay.
for medical examiners. We will be posting that. We're also leveraging some of our relationships that we have with healthcare partners and their physician list and physician recruiting. They've really stepped up to the plate and offered to partner with us for free to post those positions on those boards as well. HR does quite a good job of putting together a marketing plan and looking at nationwide, getting that word out as best as possible. So anywhere we can, we are going to get the message out about these positions.
So why would we not close our facility until we get a medical examiner and just have them prep everything at Oakland?
So you still need to operate, you have permits that are coming into the office. You also have site medical examiner investigators that are operating out of our office. So we still have to have our own staff going out to the scenes to look at the scenes and handle the scenes, to do paperwork. So there are still operations ongoing that our office has to do to keep that our side of things going, because Oakland is only handling the autopsies. We still have things like cremation permits that we have to process for funeral homes and our families in Macomb County. So there's still operational things that we have to keep going.
How many personnel are at the medical examiner's office?
Well, it'll be 16 after Spitz pathology leaves.
And how many assistants were there to the actual medical examiner?
So what SPG had is they had one deputy medical examiner, and then they had a part-time physician as well that typically did about a week a month.
We're not going to use them? We won't need them? Or we're going to still have them? I'm looking for cost here. We're going to still need them since they're going to be done at Oakland County?
So they're all under SPG. So we have posted for one full-time medical examiner, then 2 deputies positions.
Thank you, Chair.
Thank you. Commissioner Perna.
Some of the questions have been answered. When a family member needs assistance here, and there's a cremation, and the examiner hasn't yet looked at the body, is the family going to be held up now because the body's here, it's going to be transferred out there, come back here? Is that going to cause a problem with families now?
In terms of, typically that's handled with the funeral homes directly or the cremation services. So what happens is there's an autopsy. There's always going to be a lag in time. There's always going to be a waiting period, because most of the time it's not just the autopsy that is conducted, but it's also sending out samples for labs, toxicology reports that need to be done in terms of the assessment. So that takes time for those to come back, and that time frame is typically anywhere from 9 to 12 weeks currently, and that's pretty standard across the board. So there's always going to be a waiting period for families to actually have those funeral services or cremation services. So this process, once that autopsy and the lab results come in, the funeral directors, they go and they pick that body up immediately. It's released. And Oakland County does 24/7, 7 days a week releases. So I don't anticipate the families having to wait additional time.
But you just said sometime it could take 2, 3, 4 weeks for an autopsy to be completed. So the family says, I want my loved one to be cremated today or next week. And you're saying there may be an additional delay then.
Well, the medical examiner legally has to release the body. So they have to do that. That's the same everywhere. Whether it's Macomb or Oakland County, there's always going to be some period of time where the family has to wait. They can't have the autopsy today and then tomorrow cremate the body.
I understand that. Do you get any applicants from funeral homes to be an examiner?
Most of the funeral homes do not have a qualified individual. They don't have a pathologist on staff. Usually the funeral directors have different credentials requirements than a medical examiner does. It's a very specialized field. They are physicians.
What do you think is going to be this additional cost with dealing with Oakland County until we find another examiner?
So looking at that estimate, it's a fee for service, so it's $2,100 per autopsy. Looking at our numbers spread across the year, because we don't know exactly. Some months fluctuate for different reasons in terms of numbers, but if you look at the averages that we've seen the last few years, there's going to be probably about a $10,000 to $15,000 difference between Spitz Pathology and Oakland County Services.
And none of those costs are passed on to the families at all?
We try very hard that all of those costs are picked up by county budgets that we have.
But the family members they don't pick up any of that cost, am I correct?
For bringing on Oakland County, no.
So what do you anticipate an applicant? We're looking, 2 months, 3 months? What's your prognosis on that?
I think that would be ideal. I can't promise you anything, in terms of, we have put together a very competitive package, and I would love to have all positions filled by January 1st, but also know it's very difficult. It's a very competitive field. That's why we had to really make a competitive package in the first place. So that's if you ask me what the wish list is, that we have those people in place by January 1, but I can't promise that to you.
Explain to me, what was the first thing on the item here is that you rescind his resignation?
We have to, as a board, you appoint the medical examiner for Macomb County. You have to rescind that appointment and then appoint a new medical examiner.
So by rescinding it, we accepted his resignation, is really what you're saying.
It has nothing to do with the resignation. He has resigned already. He has terminated his contract and given us notice. If we do not approve a medical examiner, we do not have medical examiner services now for this county, which puts us in a very bad position.
All right, thank you.
Thank you, Commissioner Berna. Commissioner Van Sickle.
Thank you, Chair. Good afternoon. In looking around, I understand that Oakland has 4 medical examiners.
I believe so, I think.
And that they've been looking for one for a year, an additional one. And they haven't been able to find somebody in a year. Is this competitive package that you've told us about, do you think that will bust through their timeline?
I do, because it is higher than Oakland County's positions.
Because of?
The compensation package is
Okay.
better than Oakland County's package.
Because at one point you said you were going to do an aggressive local campaign, and then at another point you said we were going to look nationally. I would think that with the specialized credentials that a medical examiner needs, that there wouldn't be any unemployed around here, that you would either be stealing one from someplace or you'd get one nationally. Would you agree with that?
To some aspect, but also we've not posted this position. It is not like we've actively recruited until this point. So to truly answer that, we don't know. We don't know if there's currently, a forensic pathologist that has recently graduated or has changed positions or moved back to this area. We believe there's going to be some. We are faced with this problem eventually. There would be at some point a time frame where SPG would no longer be providing services. And so this is our way of really trying to put us in the best position possible.
Would a recent graduate have this extra certifications to be a qualified ME in all cases?
They go through a lot of different specialized training, so this is not as if they are a recent graduate and this is the first time that they are conducting autopsies. There's a lot of specialty training that goes into these requirements. So they've spent time doing the work, even as graduates. Would that be our first choice? You know, I think we'd have to really look at what we get in terms of the application pool.
Yeah, but when they testify in court, don't they need certain certifications?
They do. They need to, you know, and they have to be knowledgeable and do it well. That's one of the things we want to make sure we have is the ability for our medical examiner's office to testify in court and do a good job.
No, but I mean, isn't there some professional certifications that they need?
In terms of, in testifying? Their credentials, their medical credentials make them an expert witness, and that's what they look for.
Can we go to the fee schedule that you submitted in the packet that we received?
Absolutely.
There's a page 8 on it, and there's a page 142 on it. I don't know which one it would be in whatever you have.
The fee schedule?
Yes, the fee schedule. It's Exhibit 1, Financial Obligations.
So it's page 8 of the agreement. It's page 142 in your board packet.
Okay, thank you.
Yeah.
Is this fee schedule involved only with the transition from the current or the previous Emmy's office company to Oakland?
Can you repeat that question? I'm not quite sure.
Does this fee schedule only have to do with the transition from the current Emmy to the Oakland County?
So this is the fee schedule agreed upon that's presented by Oakland County to us for the
So in other words,
transition.
if there were expert witnesses from before, they would not be covered under this fee schedule? Or expert witnesses in the future would not be covered in this fee schedule?
Correct. This is not, that's not part of that agreement in this fee schedule.
Well, halfway down the fee schedule, you have court testimony billed to Macomb County Prosecutor's Office. Is anything from Dr. Spitz currently billed to the Macomb County Prosecutor?
I'm not aware of that. We'd have to ask the prosecutor's office that.
I thought everything was, maybe we could ask Mr. Smeagol. I thought everything from the Emmy's office was billed through the one big contract.
I don't know if you know that.
Yeah, I'd have to research that on our end as well as touching base with the prosecutor's office to see if we're billing Dr. Spitz's time as an expert witness to the prosecutors. I don't know that.
Chair, without objection, why don't we?
I was going to say, we have someone from the prosecutor's office here that might be able to answer that question.
Yes, I can answer that question. Joe Beyond on behalf of the prosecutor's office. Currently, Mr. Spitz's contract covers all court testimony. And so we're sort of left in a lurch here as far as why, under this new contract with Oakland County, all of a sudden, this cost for court testimony would be shifted to the prosecutor's office. It's not how it's been done under the Spitz contract. And originally, this move was represented to the prosecutor as budget neutral and the same level of services. And this contract doesn't meet either of those two statements, if that answers your question, sir.
Thank you. So if this is billing new charges to the prosecutor's office, do you have a budget amendment that's going along with this to cover those costs?
We do not.
So how can we approve a contract that includes expenditures against a non-existent budget item?
This is an agreement for just the services. I understand that that does not cover that service now. This is what's being presented for you all to approve.
Right, and it says that the court, I understand what you said, and it says court testimony be billed to the Macomb County prosecutor, and I believe we just heard that there's no line item that's currently covering that.
May I speak?
Yes, you can.
Sure, thank you. The intent was not to bill the prosecutor's office. There is money within the budget, as has been, that will not change. Admittedly and unfortunately, an oversight in the contract, but any bills that the prosecutor's office receives can be forwarded to us.
Can we change this in the contract to reflect what you just said?
Mm-hmm. You'd have to put it in the motion, I believe, and you can do that today, and we can update it today.
Okay.
Why are we putting it in the motion?
We'd have to amend the motion to,
Well, they wrote it. Didn't they write it?
yeah, but we have a motion on the board to approve this. We'd have to make a motion to approve it with an amendment.
I understand it has to be done today.
So, yeah, because, may I, well, really quick, so we're approving this today, we're not moving it to full board, we're going for full approval. So I would make the recommendation to make the amendment today, if someone wanted to amend the original motion, to make amendment to the original motion to, change that wording, because we have to have these services start tomorrow.
Do you have a suggestion as to what we should change that wording to?
Yes, that's what I'm saying.
Eliminate it.
They just bill to us, right?
Can we just
Yeah, can
eliminate
just
it
bill
then?
it to the health department. Or just remove it,
Move it.
remove the bill to.
Which would be best? Which would you prefer?
I'm saying.
Let's remove it, Donald. Oh, oh, oh,
Oh, no.
oh.
More complicated.
Yep.
Make it quick. Move this along.
Well, nobody's asked me to talk, but here I am anyway. There's a couple of things that we have to maintain a good grip on. First, Spitz SPG terminated the contract. We have no choice. By statute, the county cannot go without a medical examiner. That's an individual appointed by the board. We cannot have a lapse in that end of the service. The medical examiner need only be a medical doctor, an MD. They don't have to do the clinical work, the actual autopsy work. The contract is for the autopsy work, the clinical work. At this point, at this stage, Commissioner Lucido is absolutely correct. We can't have a lapse in the clinical services either. We can't rewrite the contract standing here now without Oakland County signing off on it. Internally, we can agree that rather than billing the prosecutor, we'll go to the health department or some other source. And then you also have to look at how many times does the medical examiner have to testify in court. And they support not only the prosecutor, but also my office in all of our death cases. And it's not very often per year. There's another question. What if Dr. Spitz decides, I just don't want to cooperate, you issue a subpoena? Subpoenas are issued for third-party witnesses every day. My office, the prosecutor's office, every law office issues a subpoena. Those are court orders. The individual receiving it has no choice but to show up. That's a very simple answer.
Thank you.
Otherwise, he's gonna.
I agree. So you're saying this contract has been already reviewed by Oakland, and we have to do it exactly the way it is, otherwise it nullifies what they've agreed to?
It could. I mean, they could say we didn't agree to that. Actually, honestly, from their standpoint, they don't care who's paying the bills. It's all coming out of Macomb County. It's all Macomb County money. Internally, we can just agree that rather than billing the prosecutor, it'll be billed to another department or general fund or something of that nature.
Yeah, but we all agree isn't written down. We all agree can be forgotten. We all agree doesn't work real well.
Well, we're making a record of it right here today.
Can we write that down?
So, I have a question, really quick. So can we approve this contract and then along with it, amend the motion to also include that any bills to the prosecutor's office just be forwarded to you? To the health department?
You can do that independent of, yes, that's a good
Yes.
solution. That's independent of approving the contract.
Just to make sure that it's all in writing and voted on here
Yes,
today.
a
That
separate
that's
motion
separate.
with a separate second.
Okay.
Affirmative vote.
Should have been an attorney. shouldn't it?
Okay, I'm good with
Right.
that, and I'm done. Thank you, Chair.
Thank you. Commissioner Sabatini.
Thank you, Chair. Just a couple quick
I'll have you
questions.
more
So, the existing contract with Spitz, notice of termination with that contract, how many days do we have within that contract, or how many days does each party have to terminate the contract?
Excellent question. Short answer, it's 90 days. I wrote the contract, went into effect January 22. There's a 90-day termination available to either party. Just because the party gives their notice of 90 days to terminate doesn't mean that parties can't agree to a shorter time.
Okay, so just for clarity here, he gave us his notice of termination on September 19th. So technically, we have 90 days.
From that date going forward.
So what is the, say, rush, less than 30 days that we have to enter into contract with Oakland County? Just a question.
So I'm going to have clarification to earlier questions too. So there's a transition period. We can't just go 90 days and have him continue to do cases or anyone. Same thing will happen with Oakland County when we transition out and hopefully hire employees. There will be a date where we agree to a cutoff of taking new open cases. And then one entity will close all their open cases. And then the new party will take new cases on. And that's what we're doing here. If we just let the 90 days run out, we'd be in the same position.
That's fair. The only reason I'm asking is because we have a full board next week, and this is up for full board approval today. And that's why I was asking specifically on the date, on the timeline relative to that.
Correct.
question.
And when Dr. Spitz met with us and gave us his termination, he had one date to stop his autopsies and take on new cases, which is not a date that we were necessarily prepared for, nor was Oakland County. This was a date that we came up with. We put another date out there. He came back with a shorter time frame. So this is the date that we landed at for that.
Okay. In regards to 2022, let's use that year, how many deaths or how many autopsies were performed by him relative to his contract, and or was anticipated for this year?
So overall, his average last year was about 38 a month.
38 a month. Okay. So I'm looking at your current proposal with Oakland County, which is based on $2,100 for each. And if I look at your line item in your budget for next year's proposal, that's $3.4 million. So basically, within the budget, you're anticipating over 1,600 of these to be completed. Is that fair?
1,600 of.
Now, if I take 3.4 million and I divide it by 2,100, under this contract with Oakland County, we would be budgeting for 1,600 of these.
So there's additional, in terms of there's additional fees that are a part of his contract that he charges us.
Okay.
It's just not all autopsies.
So what would be the other items then? I mean, I'm looking at expenditures by service, your proposed budget for next year. I mean, that's a pretty wide range.
So our budget covers his contract, our contractual obligations, which he has in place. So we have a set amount that he charges us in our budget every single month. And our obligation is to cover that. He also has additional services that are also covered as well in our budget. If he goes on vacation or there's additional need for coverage, we have to pick those costs up as well.
Sorry, Commissioner. Steve clarified the 3.4 million that you're referring to in the new budget. That includes all services within the ME's office. So that's for all the 16 existing clerical staff, the division director, the new doctors that we anticipate hiring. So that 3.4 is representative of all ME costs, not just for the autopsy.
So I think Commissioner Romano was talking earlier about costs. So is this a cost savings by working with Oakland County?
It is not. So I think I mentioned that it's about $10,000 to $15,000, depending on the numbers, which we don't know for sure. But if you average that out, it's approximate, probably $10,000 to $15,000 more for Oakland County.
Okay. All right. Thank you. Thank you, Chair.
Thank you. Commissioner Zhang.
Thank you, Chair. So the interlocal agreement, it appears to increase the case workload for the physicians? Is that going to be an issue with them managing our caseload and Oakland's?
So we've been told that they can handle the workload, and that's why I say they've been tremendous partners. And so they've really stepped up to the plate, and they've said they're confident that they can handle our workload.
In a timely fashion so that we are meeting deadlines if needed.
Yes, they've given us that assurance.
Okay, thank you. Thank you, Chair.
Thank you. All right, seeing no other speakers.
Sure.
Yes.
Sure. Sorry, if I could just clarify one item. I think Andrew might have missed the question on the transportation of the bodies. The bodies from the scene go directly to Oakland County.
You didn't say that, sure.
Correct,
Thank
and
you.
that's why I'm saying that was not understood. So there's no back and forth. They will come back to us if there's long-term storage to be held at our morgue, but there's not coming to ours and then they go there. And then I'd also like to say too, while SPG is still with us for the next 90 days, there are occasions that they will be in our medical examiner's office. So it would be difficult to have SPG within our medical examiner's office, then also trying to work with Oakland County and having new autopsies take place within that office. So that's just another factor, depending on how Dr. Spitz's old cases move and what they're waiting for. There may be time where all the bodies haven't been released yet, or different things going on. So that was part of the reasoning as well as having the services occur in Oakland. I just wanted to clarify those 2 points. Thanks.
Thank you. All right, seeing no other speakers, can we?
One quick question. if I could.
Commissioner Nard.
I wanted to just go back real quick because of all of this that went on when I asked about the body removal, and we're going to keep the same service that we have. Was their insurance under Spitz insurance, or did they have their own separate insurance?
They have their own.
Okay. All right. Thank you.
That's part of the bid too that we look for.
Okay. Anyone else? Commissioner Van Sickle.
Will we have to increase or modify the contract with the body removal because they're depositing the bodies at a different location miles away?
There will be additional fees we anticipate, and our budget can handle those additions.
Okay, you believe so? Okay, thank you. Thank you, Chair.
Thank you.
Andrew, as a physician, will you have any interceding in this if necessary?
I appreciate you appointing me with a medical degree, but I'm not a physician.
Oh, I thought you were a
Thank you,
physician.
Commissioner.
I'm sorry.
He wishes.
I'm sorry, I thought you were. All right, so will there be a physician in the county at any time? Do you expect that there will be a need for anyone to do to intercede during this time period? Apparently not.
No, that's part of the appointment of the medical examiner. What you're doing today is appointing the county medical examiner in Oakland County to be our medical examiner. So they are the lead physician and they have oversight.
I was thinking for short-term things in the county. All right, thank you. Thank you, Chair.
Commissioner Perna.
To tag on Commissioner Nard's question, Oakland County and the loss payable will be adding us to their contract for any liability, correct?
No, the county has its own liability insurance. Macomb has its own liability insurance provision in the contract. We will take care of our acts, and they will cover their acts.
So they're not required to name us
No,
as an
we don't
additional
have to be an
insured.
additional insured. The county already insures these risks.
Okay.
Thank you, Commissioner. So seeing no other speakers at this time, can we please vote on the motion to rescind the appointment of Dr. Spitz, approval of the interlocal agreement with Oakland County, and the appointment of Dr. Dragovic as Macomb County Examiner effective October 11th, 2023.
Did very well at pronouncing that, sir.
I can take a voice vote if yours didn't pop up, Commissioner.
Yes, but didn't pop on my screen.
Okay.
Didn't pop on yours.
Motion passes 11-0.
All right, and then I'm going to add a item C, which is the motion for the prosecutor's office to forward all invoices from court testimony from Oakland County's medical examiner to be forwarded to the health department for payment. Can I get a motion and support?
Support, Nard.
Can we please vote?
Commissioner Lucido, did your vote pop up?
No, but I vote yes.
Thank you. Motion passes 11-0.
You, Commissioner.
Thank you.
Of course. Yeah, they were all here for that.
Geez, emptying out.
The whole audience.
You
can see where everybody stands.
Hanging with nothing.
Why didn't they have it written up for us?
The good questions by the board was good.
All right. Couple people left here.
Cleared them out.
Yeah, really. Well, good afternoon, Commissioners, and thank you for having us this afternoon. I'm Dave Pankatai. I'm the CEO for Community Mental Health. I'd like to thank Lori for her kind words.
Mr. Packatay, one real quick. We're moving on to budget reviews. Can we get it by a motion to receive and file from Community Mental Health budget?
So move, Van Sickle.
Support Center.
Okay.
Now it's official. Thank you. Yeah, so it's my pleasure to bring forward our budget for 2024. It's in excess of $300 million. Things are going very well, and to present you those details, I brought people much smarter than myself. We have Ken Melvin, our Deputy CFO, and Tony Gaglio, our Finance Director, and they're going to go through those details with you. Thank you.
Good afternoon, everyone. I think everyone has this document available, so I'm going to start going through that. I'm going to cover the revenue section of our budget, and then Tony did a significant amount of work on the expense side, so we're going to kind of tag team that effort. I'm going to start here on page 2 as some of our narrative items. As far as revenue goes, as you all know, the public health emergency ended in May of 2023. A great deal of uncertainty existed. As far as our revenue goes, as we are paid based on Medicaid eligible people in the county. We get a certain dollar amount for each person. During the pandemic, no one was removed from the Medicaid rolls, regardless of whether they didn't have to turn in paperwork and these type of things that you have to do annually to become Medicaid eligible. So our revenue was significantly higher than pre-pandemic because of that. So as a result of the end of the pandemic, kind of waiting to see what would happen as a result of that. So our budget as it sits right now, what the state of Michigan did with our most significant sources of revenue are Medicaid and Healthy Michigan, is they took our rates for each one of these individuals and increased those rates to offset the anticipated decrease of the number of Medicaid eligible people in the county. Their goal was to do that to the tune of 70% of that decrease. So if we expected just in round numbers as an example, a $10 million decrease, because we have less eligible people we're being paid for, they were raising our rates for the people we would be paid for by 70%. Now that's a very rough estimate. A lot of detail goes into each person and their rates, which we've done and calculated here based on our expected decrease in enrollment. So the good news is that as a result of that and the increases of rates that the state has done, we expect to actually be slightly higher than our previous budget position, even with the unwinding of the pandemic. So that's great news for us. I will qualify that by saying that as experience comes in, we really only have 2 months or even 1 month of decreases in eligibles from this summer that the state is basing their experience on. And they may come through partway through a year if that experience differs with rate adjustments. If that's the case, then we would have to come back with an adjustment. But at this time, we feel this is the best information we have and don't expect anything like that to happen. So bottom line, our major source of revenue, so we can see on page 4, which is the accumulation of all of our funds. You can see Medicaid and Healthy Michigan for our 2024 proposed is $275 million out of our total of 307. So that was the revenue sources I was speaking to just now, and we expect them to remain high going forward. So that's a good thing for us. Going through some of our other revenue sources on this page, on page 4, you'll see that there's a decrease in our MyHealthLink revenue compared to our 2023 budget. The reason for that is that we have collaborating organization. We formally contracted with 5 ICOs, which is integrated care organizations. They were 5 insurance companies, effectively, that we contracted with to provide this program. Going forward, we're only contracting with 2, hence the decrease in revenue for that line, as expected. Our state general fund dollars, 5 years ago, the state put us on a titrated schedule that was going downward of how much general fund dollars we received from the state of Michigan. That has since flattened out, and we expect that $7.4 million to be the ongoing allocation that we received from the state. County appropriation, I'll get into that when on the separate pages where we actually break it down by fund, because I think it'll be more meaningful in that way. Grant revenue is up. We have some new revenue sources, particularly for our substance use program, that are tied to ARPA, and some COVID-19 dollars that we had flowing through and expect to have into next year. And then I think that's all I wanted to highlight for revenue, except at the bottom of the page. You can see our investment income has gone up quite a bit. The reason for that significant increase is because we cost settle anything we don't spend with the state of Michigan on an annual basis, but it is in arrears. So we just settled fiscal year 18-19, and because of the pandemic, we had very significant liabilities that we owe to the state of Michigan. We also have the cash because we haven't sent it back yet. That cash is sitting in investments and earning interest, which we can keep as local funds. So that's also good news for us. Don't expect that trend to continue probably past 2026 once we've settled those outstanding liabilities. But that is what's shown going forward. I might pause now. Take any questions about revenue if we want to do it that way, or certainly at the end.
Brown.
Yeah, thank you. Thank you for being here. I appreciate it. We don't get to hear from you very often, except this time of year, and you have a very complex job over there, and you haven't been without your challenges. And this year's still a challenging job, but it's not as dire as it once was. But I'm curious about the State General Fund S.B.A.P.T. block grant line. It's the same for 4 years. And thought the number you said was actually lower with the amount of money you're getting from the State General Fund.
The state general fund is leveled off, so if we look at,
Is that, am I looking at the right line? Is that, is that 742?
742 is the state general fund. So I do appreciate you pointing that. I was gonna circle back to the county appropriation / PA2 and speak to that. So if we go to page 5, I think this might answer your question on that. You can see that the, county appropriation on page 5 is $3.7 million. That's actually what the county pays us out of their general fund. And we expect that to be flat at $7.5 million going forward. The reason it differs from fiscal 23's number is because the SUD fund, we added that into the mental health fund. There is no reason to separate those two and have separate payments for those. In total, the ask of the county's general fund is the same total. We've just not included it in the SUD fund, which is on the next page.
Are you required to follow Gatsby accounting principles the way our county operation is as well?
Absolutely.
So that's consistent with Gatsby then to do that, combining those?
It is. We could actually eliminate the SUD fund and have one. And in the county's financial statements, all of our funds actually roll up to one presentation in the ACFR that the county prepares.
Thank you. Appreciate it. Thank you, Madam Chairwoman.
Thank you, Commissioner Brown. Commissioner Sabatini.
Thank you, Chair. So just trying to see what I'm looking at here. So the document that you've given us differs, at least what I'm looking at compared to what our actual budget says. We're looking primarily at the budget. So can you just clarify that? And so we have two items here that you're discussing. First being the mental health fund, and then one being the substance abuse fund. So we have them separated in our budget, E3 and E4. Can you tell me, so that's my first question is, compared to what you've given us and what we have, why is there a difference? That's the first question.
Know what we have.
Possibly so. So I think, Commissioner, what you'll see is on page 4 of the mental health document is the combination of the mental health fund and the substance use fund. And then the next 2 pages are those 2 funds broken out separately, as they should appear in the budget.
So page 5 should match our page
E2,
E3.
Yeah, is that?
And it does not. So
It
if I
does
just look
not.
at revenues, if I'm looking at my revenues for 2024, which is proposed, on the handout, it's 279 million, on our budget is 276 million. That's the first question, and then obviously going down, but.
Probably because the county appropriation of 3.7 is up in the revenue section of the mental health document. It's down below under transfers in.
We did that, it's still a little off.
But still,
I think I know what it is, because
and the reason I'm asking this is if there is an error in here, we have to fix it appropriately.
So I know what it is, Steve. So our 279 on page 5, and then if you look at page 7 of the handout, it's 276. Does the 276 matches what you have as well, right?
Yep.
Okay. All right, so.
We're getting closer.
Going back to page 5.
Okay.
The group home revenue, that's the second line from the bottom.
Got it.
It's a classification issue. So page 5 is our detailed breakdown that we send to the CMH board. That group home revenue is netted against expense on page 7. in the county's presentation. The reason being for that is that we don't own, how many homes do we lease right now, Dave?
About 75.
So we have 75 homes that we hold the lease on. We pay the lease to the landlords. There are providers that are operating in those homes, contracted providers that aren't part of this organization. They are responsible for that cost. So what we do is we withhold from their claims checks where they're billing us for services the amount of these leases. In the detailed breakdown on page 5, we have that recorded as revenue, as that presentation is slightly different. In the county's presentation on page 7, we don't really have a great account to put that in. Other revenue would be significantly inflated if we put $2.7 million there. So it is offset against expense.
I see your group home expense, so it's zeroing itself out.
Right.
Okay. All right, that answers that question. Next question I have is, you actually already addressed the investment income. Personnel. So it looks like in 2021 to 2024, your personnel has literally almost doubled. Can you talk a little bit about personnel and the challenges that you're having and, I mean, the huge increase? Because I'm looking at your total position counts, which have remained the same over that course of that same time frame.
Are you looking at personnel on page 7?
No, I'm looking at E3, our budget.
Oh, I see.
I'm looking at our budget.
So it is worth noting that Tony's gonna, that would be helpful.
Those are actuals, those are budgets.
Okay.
So the question, part of the problem or the issue is, Commissioner, 22 and 21 are actuals.
Okay.
All the other years are budgets. So that's, if they had unfilled positions, those sorts of things, then the actuals are gonna be far less than the budget. They have a significant amount of vacancies typically.
I will say that the budget is, yeah, I'll do that. Thank you, Steve. The budget is, Tony, do you want to speak to the personnel piece of the budget?
I can.
Yeah.
So one of the, hi, Tony Gaglio. One of the factors there is Steve Schmiegel said that you're looking at actual in 21 and 22, and then when we're looking at these other columns, that's budget. The way we've approached this budget is we are assuming that our complete complement of FTEs, so from our manning table, would be filled. At the moment, we're running probably about 80 vacancies, which is pretty consistent, you know, as we strive to fill those, but our manning table is based on the needs of our organization, and the budget reflects having all those positions filled. Now, the likelihood of having them all filled is, you know, is low, but at any given time, we're going to have, you know, 50 or so vacancies. So that's probably the biggest factor if you're looking at actual going into budget. Does that answer your question?
So for 2023, what's your anticipated savings in that line item?
In 2023, based on actual and the vacancies, that's a good question. I don't know if I have the number right off.
You don't have to give it to us now, but if I'd like to get that
follow-up.
That follow-up.
Yep.
It's also worth noting that in the 24 budget, we have, that's an additional 6% that we anticipate in January. And that our budgeted vacancies are at the top end of the range. The reason being that, like you said, there's some challenges with hiring. We feel that it's gonna have to be at the high end of the range to attract quality candidates.
So specifically on that point, if the budget is approved with a 6% increase in salaries, is that going to solve your problem in your hiring situation relative to those 80 FTEs that you haven't been able to fill, let's assume this year? You're going to be able to fill them next year with a 6% increase?
I can start, and then Dave, you go.
Because this is a big problem that we're having. And, you know, we've done classification changes with the county. We've done a lot of different things, and we're still struggling in bringing in people in these positions to fill them. And that's why I'm asking this specifically.
I mean, just starting off, the 6% makes us a little bit more competitive, but is it going to solve all of our vacancy factors? No, but Coming from the healthcare background, we're facing some of the same challenges that even the health systems are facing. It's not all about rate and pay rate. It's really about the number of resources available, people even leaving the field. So we're competing directly with the large health systems, the therapy practices. So we're going to have to get more creative. So rate, at least, the 6% makes us competitive, but we, again, have to get creative in how we're going to attract and retain qualified staff. Dave, if you want to add to that.
Thank you. Thank you, Chair.
Thank you, Commissioner Sabatini. Seeing, anyone else have any questions?
If I could just make a couple more comments.
Yeah.
So as Ken mentioned, we've accounted for the 6%, but then one of our other major line items, of course, is paying our provider network. And we work diligently to work with each of our providers, manage our contract costs. We did do a very extensive review this year to accomplish a couple goals. One is to implement what we're calling standardized rates. We had a lot of variation across our providers, so we put in a lot of work to look at the cost structure, look at how we're paying and our provider network, and to standardize that. So that's reflected in the budget, so we can have a stronger, or maybe a better structure as we approach the needs of our provider network and their request for rates. And the other thing that we've done here is there was a state mandate to pass through a direct care wage increase. So there's an 85-cent per hour for a subset of our employees. That's reflected in this expense as well, but that's going to be a pass-through from the state directly then to the providers. And then we're working on a process to have oversight of that to ensure that those get passed through to the providers appropriately. Where we had providers that did not receive that, we did factor in a 3% increase, again, trying to keep up with some of the inflationary costs that our providers are experiencing. So there's a subset of our providers that are going to get the 3%. And then for our hospital inpatient, we are going to increase their per diems by $25. So those are some of the major assumptions that have gone into our provider network costs. And then overall, for all of our, just our local administrative office type costs, we've included a 3% inflation factor. So those are probably your main highlights that are driving the expense for the budget.
Commissioner Van Sickle?
Thank you. I'm not a financial person, but you have me totally confused because pages 5 and 7 have exactly the same title on them. And pages 6 and 8 have exactly the same title on them, and the data is all different. I would suggest we have a little bit better descriptive titles on 5, 6, 7, and 8.
Right, so 5, 6, 7, and 8, it is, they're presented differently. So as on page 7 and page 8, you can see that the mental health fund and the SUD fund are the same as pages 5 and 6 respectively. Unfortunately, the date at the top where it says 2023, 2024, and 2025 budgets should say 24, 25, and 26. So that is a typo effectively on those because it doesn't match what we have. But the reason that 6 and 7 are different, I'm sorry, 7 and 8 are different is because the pages 7 and 8 are the way that these numbers are presented in the ACFR and the financial statements, and also flows through to the county's general ledger system. Whereas pages 5 and 6, it's the same information, but it's less aggregated in a detailed breakdown, so we can see, okay, we do have Medicaid, Healthy Michigan, and My Health Link revenues, for instance, whereas that rolls up to charges for services on page 7, for instance. So it's the same information, just presented in a less detailed format in the back. Does that answer your question?
The balances don't come out to be the same numbers. So if it was the same information just rolled up, categorized differently, I would expect the totals to be the same.
That group home revenue that I was discussing earlier is causing a difference there, $2.7 million.
I'm really not following, but I'll have to, I don't want to hold up the meeting, so I'll just pass the baton for right now. Thank you, Chair.
Thank you. Commissioner Brown?
Your provider network, how many county employees do you have access? Start there. How many county employees do you have that are affected by things that we do in HR here for pay increases and so forth?
So in our provider network expense, that's all contracted work. There's no county employees there. But as far as our direct run operated services, how many county employees do we have, Dave?
I believe it's about 150.
Now, back during COVID, there was a proposal, or maybe you did it, to offer bonuses to certain employees that weren't county employees. And there was great concern on our part that we'd have two tiers of people over there expecting the county employees to get something that the other half of your workforce didn't get. And are you thinking about doing something similar to shore up your shortages in care, your employees that you're looking for? Or are there two different pools? I'm just wanting all those.
Yeah,
the intents by my question, I'm not 100% sure of.
We're considering all options. We've done a lot to support our provider network. We've done capacity building grants. We've done stability payments. We've done special programs trying to help meet the needs of our community, which have been increasing. Last year, we fumbled on a across the board kind of recognition payment that never went forward. We went back and we were able to do a retention and a hiring incentive payment and a referral bonus within our provider systems, not within any of our direct run programs for Macomb County staff. That was well received. It was not, there was no net measurable increase. With Tony's help and with Ken's help now too, we are continuing to refine our contracting, and we're moving now to value-based contracting, and we'll have some of those first value-based contracts going forward. So now if we give somebody some extra funds for a certain reason, it's going to be tied to outcomes that we want to see. So that's our new focus as we continue to refine ourselves and our data. So hopefully next year we'll be able to show you some actual outcomes that we spent X amount of money and in return we were able to move the needle in certain areas. Access being the key one right now.
Sounds interesting and hopeful. I look forward to hearing the results next year.
Thank you.
Thank you. Thank you, Madam Chairwoman.
Thank you. Commissioner Ha.
Wallace aren't here. They did send us a very lengthy email with a glowing endorsement of CMH in the way you're operating and functioning today, listing many challenges still confronting the organization, but we feel very, very confident with those two there in your organization, things will keep moving in a positive direction. So
thank you so much.
Thank you for what you do. I just wanted to mention that on Phil's
Commissioner
behalf.
Kraft's message was, very nice.
Oh, you got it too, huh?
I did see a copy of that. Thank you so much.
Okay, thank you, Chair.
Want to have proof.
All right. Seeing no other questions, can we please vote on them? Thank you.
Motion passes 10-0.
All right. Did we get a motion to receive and file the substance abuse budget? All right, then we'll move on to item B, which is Martha T. Berry. Motion to receive and file, budget pages E1.
So moved by Nard.
Support Van Sickle.
And we have Mr. Evans here this evening. I think everyone got an updated copy of the budget for Martha T. Berry.
Thank you, Madam Chair. Thank you, Commissioners. I'm so excited that you saved the shortest and simplest for last. My budget is a tithe of what the mental health is, and it's a simple one-pager. It is pretty straightforward. You see that our increases have gone up commensurately with a market basket for cost increases across the board. If you take a look at our staffing, we're actually in great shape. We receive the employee retention credit, which we use to mitigate the challenges of hiring, and it helped to a great extent. We were able to actually eliminate agency in our building in its entirety as of September. We have 0 agency in the building, and that was because we used the money to hire and have the right systems and services. The reputation of Martha T. Berry continues to grow, and that was a lovely report earlier. But it's because of the support that we've had with the county commissioners over the years, and that we use the money in the right way to make sure that there are people at bedside caring for the residents. So I don't think there's anything particularly earth-shattering in there. If anybody has any questions, I'd be happy to answer that. One thing I think is important to note, even though it's called an appropriations budget, the county commissioners provide $0 for this, for Martha T. Berry operations. No money for Martha T. Berry operations since I have been there in 2016 April. There are no money coming from the county funds specifically for the operations of Martha T. Berry.
Thank you, Mr. Evans. Anyone have any questions? Seeing none, can we, Commissioner Sabatini?
Thank you, Chair. Hey, Kevin. I'm looking at this, and I had to look at it twice just to make sure it was correct, but how did you decrease your personnel and increase your employee count? At least that's what's budgeted for 2024.
Let me take a look at that. Let me double check with that, but it looks like we probably had a switch in full-time to part-time employees. So when we're looking at FTEs, we've added a number of part-time employees as well. So that's probably where it came from.
I mean, you increased your total position count by 2 FTEs.
Right.
And your personnel line item went down by almost $2 million. 1 point.
Oh, the personnel mostly has to do with, it's a combination of things, really. We have a lot of newer employees over time. We changed some of our packages over time, so that cost is decreased. We went to some part-time, again, to get more work-life balance. There's a lot of people that we used to have just straight full-time. So we went to a lot of part-time positions because that's what people are asking for.
Okay.
We also had, we also made some changes in terms of how we were scheduling and reducing cost. We eliminated and froze some management positions as well. So it's a combination of a lot of things that we did.
So would it be fair to say that you became a little creative with your personnel challenges?
I would say yes. Yeah.
Sure. Thank you. Thank you, Chair.
Commissioner Hall?
Kevin, I was looking at the one that we had in the book on page E1 versus the one that was just handed to us, and these numbers substantially change. I was looking at personnel 2022 at 17.4, 2023 in our book 21.6, then it goes from actual 17.4 to 24.7. How is it these numbers have substantially changed since the time here he comes, the guy behind you, we received the budget in this sheet? I mean, I studied one sheet and now I was just handed another.
So the updated sheet includes the budget amendment that Kevin brought to you in September that we didn't get a chance to roll into the recommended budget. That's what the new sheet reflects.
Okay. So the one that we were just handed is the one we're gonna functionally operate with?
Correct.
Okay.
So if you follow.
You're off
so
the
that-
hook,
that
Kevin.
includes-
Thank you.
Yep. Yes.
That's all I have, Chair.
Thank you.
Thank you, Commissioner Hall. Anyone else have any questions for Mr. Evans? Commissioner Brown?
Again, what's the current rating? Did your rating go up since the last time we talked? It's been going up consistently, so.
Yeah, no, we're still at a 4-star facility. We're still waiting for our annual survey. As soon as we get that, we're confident that we'll be a 5-star at that point, because from 2018, we have 3 surveys that will be dropping off at that point. So yeah, we're fully hoping to be at a 5-star the next time the surveyors come through. So.
Thank you, Kevin.
Thank you.
Thank you, Madam Chairwoman.
Thank you. Seeing no other speakers, can we please vote?
Chair?
Oh, Commissioner Zinner.
I'm just saying, I just want to say that I think when a group of us came on, this is our 3rd year, I think you were at a 2 in 3 years. Yeah, I was.
Never been at a 2.
You were always,
Yeah,
you're always at a 5 in our heart, but I mean.
Well, yeah, I appreciate the vote of confidence, Commissioner Romano, but when I first got there in 2016, we were 1-star in overall quality. We were 1-star in quality measures, and 1-star in surveys. So the only thing that we had better than 1-star was our staffing levels, which have always been 4-star. So no, so it's been a trudge. I thought we'd be there already, but COVID hit, and they froze actually a lot of ratings because everything was so askew. To give you an idea, we got how serious they were about infection prevention. We had somebody that had their mask down under their nose, and they gave us an immediate jeopardy citation during that, and fined us $45,000. So that gives you the idea of how volatile that is. So, but no, we're very pleased, and thank you for the kind words.
Congratulations.
Thank you.
Thank you, Chair.
Commissioner Sabatini?
Thank you, Chair. Kevin, I just want to echo that. I was looking at your budget here, and I didn't mention this, but, when I'm looking at your 2021 budget, you had a shortfall of $5.2 million. You're forecasted in 26 to have an $18,000 surplus. That's huge. I mean, that's remarkable. Keep up the great work, and we hope it exceeds the 18.5. But it's just great to see that on a budget.
Thank you. Thank you.
Seeing no other speakers? Thank you. Can we please vote? Yes.
Motion passes 11-0.
I think my update already occurred.
Yes.
Just in the interest of time.
Yeah, you did too.
With
We'll move on to presentations. Do you have anything else to add? Motion, Mr. Evans?
Motion to receive and file.
I was going to ask him if he had anything first, but okay.
No, just continuing on from the conversation from last month, I really appreciated Commissioner Romano when he said, give us time to heal. So I think we're headed in the right direction on that. Had a great conversation, actually a couple of conversations with Skip in the Treasurer's office. Some of the things that they were asking for, we're able to figure out for them. I appreciate your patience while I learned to transition from functioning as an enterprise to functioning as an appropriations. I think we have to get a few things squared away in terms of the joint operating agreement, so it's in alignment with all this other stuff. But I know that I am in authority, under your authority, and it's a privilege to serve you here. I just want to make sure that I meet or exceed your expectations, and I would very much like the stuff that happened this year to just be set aside and let's move forward. Thank you.
We agree.
Thank you. Can we please vote?
Didn't we vote?
Yes.
Motion passes 11-0.
And then we're moving on to correspondence, which is a letter from the chair for the $2 million appropriation. Motion to receive and file.
So moved.
Support, Nard.
Will we please vote? Or I don't know, are there any questions? Will you please vote? I'm going to vote no.
Commissioner Hall, did your vote come up?
Nope.
Okay. And I'm also missing Commissioner Sabatini. Yes? Thank you. Motion passes 10-1. Commissioner Lucido voting no.
Nothing that matters now. All right, moving on to public participation. At this time, anyone from the public that wishes to speak will have 3 minutes, and they can speak on any issue they'd like. Seeing no one, we'll close public participation and move on to commissioner comments. Commissioner Sabatini.
Thank you, Chair. Thank you for kicking off the budget for us. Appreciate that. I just wanted to, talk about one quick item, and that's in regards to what we actually were talking about here today during our presentations, specifically with personnel across the board. I know that the budget has a 6% increase, and what we heard today was that that's not going to solve all of our problems. We still are going to have personnel changes. I know we've made modifications to our structure to help us with our personnel changes, but I think one of the things that is hitting me is that when we adopted our budget last year, and I look at it, and you can all look at this as well, because it's on page C1 of your budget, and you look at your personnel line item, what we forecasted in the adopted budget for last year is, in 2025, is less than what is recommended for this year's line item for personnel. So I just want to be aware of that. With a 6% increase, that doesn't include all the fringes and everything else. So I think we need to just be cognizant of that as we talk to departments and look through this budget, because it certainly is going to be a large number, not only this year, but upcoming in future years. So just wanted to say that. Thank you, Chair.
Thank you. Commissioner Ha.
Thank you. Joe, if I could add a little asterisk to your statement, which I agree wholeheartedly with. The statement was made no additional headcount unless they were grant funded. That was the statement. Thank you.
Thank you, Commissioner Ha. Seeing no other speakers.
Motion to adjourn.
Oh, brother.
Support Zinner.
Please call. Vote.
He didn't even ask.